The introduction of motor conduction velocity.
What is motor conduction velocity? Motor conduction velocity obtained by stimulating a motor nerve and recording at the belly of the muscle innervated by the nerve. The CMAP is a resulting response and depends on the motor axon transmitting the action potential status of the neuromuscular junction and muscle fiber. Conduction velocity is calculated by divide distance by time. However, the distance between two stimulation sites is divided by the distance in onset latencies of the two sites, providing the conduction velocity in the segment of nerve between the two stimulation sites. This method of calculating conduction velocity thereby avoid by being confounded by time spent traversing the neuromuscular junction and triggering a muscle action potential.
I'm going to explain about related disease or symptom that's suitable for the MCV test and also the risk after taking the test. Before we look more clearly to the disease that related to MCV test, actually there are many diseases that is related to, but in this video I'm going to explain only 3 diseases and the symptom about the disease. The first disease is Gullain-Barre syndrome, GBS. It is a type of peripheral neuropathy in which the myelin covering and/or neurons that innervate the head, body, and limbs degenerate. This deterioration is caused by an immunological reaction triggered by a variety of illness. There are 2 types of demyelinating: Schwann cell damage and axonal damage, which is direct nerve fiber damage. Depending on the specific manifestation, each of these then branches into various subcategories. The illness in all cases causes limb weakness or paralysis as well as potentially fatal paralysis. There are more than 5 symptoms of Gullain-Barre syndrome. There are prickling, pins and needle sensation in the fingers, toes, ankles or wrists of the patient. Next is weakness in the leg that spread to the upper body. After that, unsteady walking or inability to walk or climb stairs. Moreover, there are also difficulty with facial movement, including speaking, chewing, and swallowing. The patient also experiencing double vision or inability to move their eyes. Now, let's move on to the second disease, which is carpal tunnel syndrome, which is also known as CTS. Carpal tunnel syndrome is a type of nerve compression condition that occurs when the median nerve at the wrist is compressed. Electrodiagnostic testing is also beneficial in the case of CTS. However, both Tinel's and Pallen's tests should be conducted before a patient is subjected to nerve conduction examination. If both tests come back negative, the patient is unlikely to have CTS and additional testing isn't indicated. Carpal tunnel syndrome patient may experience numbness, tingling, burning, and pain, which is primarily in the thumb, index, middle, and ring fingers. There is also occasional shock-like sensation that radiate to the thumb and index, middle, and also the ring fingers. Pain or tingling that may travel up to the forearm towards the shoulder. The last disease, which is cubital tunnel syndrome, which is also known as CTBS. Cubital tunnel syndrome is a condition in which the peripheral nerves are compressed. The ulnar nerve is irritated or injured in the cubital tunnel at the elbow. The second most frequent compression neuropathy in the upper extremity after carpal tunnel syndrome is ulnar nerve entrapment. It causes the patient a great deal of pain and suffering, and in the worst case scenario, it might also result in the loss of hand function. Cubital tunnel syndrome is a condition that is frequently misdiagnosed. Here are the symptoms that the patient experiences for cubital tunnel syndrome. Numbness and tingling in the hand or ring and little finger, especially when the elbow is bent. Numbness and tingling at night, hand pain, weak grip and clumsiness due to muscle weakness in the affected arm and hand. Lastly is aching pain on the inside of the elbow.
Electrode attachment on subject. The nerve is stimulated supramaximally by means of surface electrode placed over the nerve where it is relatively superficial, with the cathode is closer to recording electrode. Needle stimulated electrode is used in deep nerve as sciatic nerve. Maksudnya, saraf dirangsang secara supramaximally dengan menggunakan elektrod permukaan yang diletakkan di atas saraf di mana ia agak superficial dengan katod lebih dekat dengan recording electrode. Needle stimulated electrode digunakan pada saraf dalam sebagai saraf sciatic. Recording from one muscle supplied by this nerve is the style of stimulation using surface electrodes, that is active electrode over MS belly and reference electrode over MS tendon. Maksudnya, rakaman dari satu otot yang disediakan oleh saraf ini ke lokasi rangsangan menggunakan elektrod permukaan yang merupakan active electrode di atas perut MS dan reference electrode di atas MS tendon. Next is type of electrode with the position. Active recorded electrode G1 placed on the center of the muscle belly that is over the motor end plate, iaitu diletakkan di bahagian tengah perut otot yang berada di atas pelat hujung motor. Yang kedua, reference electrode G2 placed distally over the tendon to the muscle, iaitu elektrod diletakkan secara jauh di atas tendon ke otot. Yang ketiga, stimulator placed over the nerve that supplies the muscle, iaitu elektrod diletakkan di atas saraf itu yang membekalkan otot. Cathode placed closer to the recording electrode, black to black. Cathode pula diletakkan paling hampir dengan elektrod rakaman, iaitu hitam ke hitam. Terakhir sekali ialah ground electrode. Ground electrode placed in between stimulating and recording electrode. Ground electrode diletakkan di antara stimulating dan recording electrode.
Continue about the procedure of the test motor conduction velocity. First thing happen during a motor or nerve conduction velocity test are the nerve conduction speed procedure can be done on an outpatient basis as a part of hospital stay. The procedure may vary depend on your conduction and your doctor practice. MCV is performed by neurologists, although technologists can also perform some part of the test. So, in generally, procedure are follow the process. 1. Doctor say need to remove clothes, jewelry, hairpin, glasses, hearing aid, or other metal object that may interface with the procedure. If you are asked to take off your clothes, you will be given a dress to wear. Number 2. Patient will be asked to sit or lie down for this exam. A neurologist will look for the nerve to be studied. In addition information, conduction velocity is depending on internoid distance, with a BARRE maximum center around the volume observed in a normal peripheral fiber. Conduction velocity is also depending on the temperature and the properties of axonal. Number 3, the recording electrode will be attached to check skin over the nerve with a special space, and stimulator electrode will be placed at a no distance away from the recording electrode. Number 4, nerve will be stimulated by a light and brief electric shock given through a stimulator electrode. You may experience some discomfort for a while. And the last number is 5. The nerve stimulate and response detect will be shown on an oscilloscope. Oscilloscope is a monitor that displays electrical activity in the form of wave. As a general no, NCV test painful or not. It shall not be painful, but may cause minor discomfort. There will be no pain after the test is complete. The stimulate and nerve response will appear on a monitor for a doctor to record. A person may need to an EMG test following the NCV test.
Result of motor conduction velocity.
Firstly is nerve conduction study. The amplitude of the muscle response to supraproximal nerve stimulation can be measured. The time for the distant site of stimulation to the onset of the CMAP is the terminal of distant motor latency. This measure include component of nerve conduction, neuromuscular transmission, and muscle activation times. The difference in time of CMAP between the two sites of stimulation and the distance between is used to measure conduction velocity. Next is compound muscle action potential or CMAP. Firstly is amplitude. Amplitude was commonly measured from baseline to negative peak. Amplitude also less commonly from the first negative peak to the next positive peak. Cause of low CMAP is demyelination with conduction block, presynaptic and MJ disorder, and advanced myopathy. Next is CMAP duration. CMAP duration measured from the intentional deflection from baseline to the first baseline crossing. Duration is primarily a measure of synchrony. Duration increase in demyelinating disease. CMAP measure the speed of the fastest conduction motor axons. Lastly is motor nerve conduction. The directly involved muscle action potential recorded after stimulation at T1 of peripheral, and this AP called M response. The same nerve is stimulated similarly at a more distanttial point, and this latency is also recorded. The distance between 2 points of stimulation is measured in centimeter. The formula below shows the velocity of conduction of meter per second equals distance divide T1 minus T2 that multiply with 100.
So the conclusion, motor conduction velocity, CV, is an important aspect of nerve conduction study. It is the speed at which an electrochemical impulse propagates down a neutral pathway. Conduction velocity are affected by a wide array of factors which include age, sex, and various medical conditions. Study allow for better diagnosis of various neuropathies, especially demyelinating disease, as this conduction result in reduced or non-extant conduction velocity. In addition, the conduction velocity is depend on internode distance, with a broad maximum center around the volume observed in normal peripheral fiber. Conduction velocity is also depend on temperature and the properties of the external milieu, and the global accuracy of the test was 61%. In all the patient will probable CIPNM and abnormal echogenicity. The sural and peroneal single NCS were both abnormal. The head slow nerve conduction is with decrease in temperature. There is consequent reduction in the sodium permeability of nerve axons during the excitation, result in a slower sodium influx and increased latency. Means slow neutral conduction.